got some pain in my shoulder and then my middle back. Pretty sure it's from work. I do a lot of heavy lifting at work for a long amount of time, so. For a couple of years now. For my shoulder, it's more throbbing, but for my back pain, it's sharper.
What are your expectations?
For my pain to go away, I guess.
And try and touch your toes. Lean back as far as you can. Good. That one hurt?
Yeah.
How about bending to the side?
Not that side.
Okay. And then this side?
Yeah, that side.
That gets it?
Mm-hmm. Not that much.
And then this side?
Yeah, a little bit.
A little bit. Again, on this side.
Yep.
All right. Range of motion's not too bad. You're a little bit limited on the lateral flexion. Any pain there?
Just but not.
Right here a little bit.
Mm-hmm.
We lift this leg, any pain?
No.
Okay. If I bring the leg up this way, any pain?
Mm-mm.
And then this way?
No.
Okay. Very good. Any back pain?
No.
Okay. So when you fell and hurt your elbow, fractured your elbow, did you hurt your lower back or leg or anything like that at that time?
No, I just fell off a couch. I was like 4.
Oh, okay. All right. Now what I'm feeling for, I'm feeling the spine. I'm feeling the position of the vertebrae in your back.
Mm-hmm.
And I'm also feeling for the tension of the muscle. The worst spot's right there. That tender?
Yeah, it's usually where it hurts.
Yeah. Okay, so that vertebrae is rotated to your right side, so it's twisted a little bit, and it's causing those joints in your spine to be out of alignment, and it's causing irritation to those joints. What we would need to do is adjust that and get that to move and get the motion better, but also get the alignment better, and that'll help to relieve the pain and stiffness in that joint.
Okay.
Okay, we're going to place our hands right here on this, right over the vertebrae that needs to be adjusted, and push down straight into the tail here. Okay. Okay. We can also use this tool, the arthro-stim manipulator. And we can jackhammer on that vertebrae, and this will help it to move a little bit as well. So one treatment isn't going to take care of it, you know that, right?
Okay.
It's going to take more than a couple of treatments to fix it. And then you got some spots up here that need to be adjusted as well. And this is part of the shoulder problem. So this area needs to be adjusted too. That one I feel worse on the left right there.
Yeah, I guess I can feel the difference.
Yeah, it's the right side that hurts, but this one is it's twisted and it's tilted this way. Okay. And we do the adjustment this way. Okay. You also have something going on here.
You feel it.
So you have a lot of spots that need to be worked on. And each time you get adjusted, the pain and stiffness gets better. And then the next day or two it starts to come back. The pain will start to gradually return, but not get as bad as it was when you first came in.
Okay.
And then each time is like 2 steps forward and then 1 step back.
Yeah.
2 steps forward, 1 step back. Okay? So it's a gradual improvement over time.
Okay. Yeah. Thank you.
Yeah.
It does feel better.
Good.
It was very informative, and I liked it. Learned a lot. Need to learn how to stretch, though.
On a scale of 1 to 10, how much better does it feel right now at the moment?
Right now, from when I walked in, probably a 10.